today as we continue with the session. My name is Samuel Kele from Eswatini Hospice at home, and I'll be the facilitator of the day. I would like to welcome you today. Will be joining us later, and who are joining us today. I'm very grateful for this day. Before we continue, colleagues, we'll start by our introductions so that our session will go smooth. We'll start with the EHA team, which is our hub for this eco session. Everybody can just introduce themselves so that we know each other. From Mr. Makalo.
Hi everyone, my name is Sandile Mahlangu, Eswatini Hospice at Home Eco Coordinator.
Good day, colleagues. I'm Pius Pugari, the hub team.
Good afternoon, colleagues. I'm Mercy Shabana from
Good afternoon, team. My name is Lowanda Mtepa with the Hospice at Home team.
Hello to you all. My name is Fondes Melane, here at Hospice at Home team.
Good afternoon, everyone. My name is Nondudu Zotani for Hospice at
Good afternoon, everyone.
Good afternoon, team. My name is Lindsay Zambini. Afternoon, everyone. I'm Specialist Nurse from Hospice.
Okay, thank you. We'd like to welcome our colleague from India, Malaika. Are you there?
Hello, everyone. I'm Malaika. I am executive at Eco India, and I'm glad to be part of the session. And I provide all kind of support to the team. Thank you so much.
Thank you so much, Malaika. We are also welcoming Sister Trustee Mamba.
Afternoon, colleagues. I'm Trustee Mbata from Sanu Lecturer at Palliative Care. Thank you.
Thank you so much, Sister. It's Mbata, not Baba. It's just my eyes. Sorry for that. Colleagues would like to continue. I think, okay, we can also see Nompumelelo Mhlanga. May you please, Marga, introduce yourself?
Good afternoon, team. I'm Marga Dlamini. I'm very grateful to join you in this session. Thank you very much.
Thank you so much, Ngozi. Okay, I think we can start with our session. Last session, we were talking about mind-body treatment approaches for managing pain in palliative care. We are still on our pain management. So last time we were talking about pharmacological management and we are still on the non-pharmacological approaches for managing pain in palliative care. So we'd like to just remind everyone, colleagues, that we put our phones, our gadgets on silent mode so that we cannot disturb our session. So all gadgets should be remained muted. And also, if you want to communicate, please communicate by simply raising your hand or just indicate on the chat box. We will see you there in the chat box or simply raise your hand. So today's session will be talking about the herbal preparations and dietary supplements for pain management and care. And our very own nutritionist, Norbert Tempa, will be taking us through our today's presentation, which is about herbal preparations and dietary supplements for pain management in palliative care. So I think our sister is ready to take us through this opportunity.
Good afternoon, colleagues. Once again, my name is Noanda Mtepa, as mentioned earlier. Today we're going to be looking into herbal preparations and supplements for pain management in palliative care. So the objectives of this presentations are going to be to identify the important nutrients in pain management, explore and discuss herbal medications and supplements. We are also going to explain preparations and uses of these herbal medications. To introduce this topic, I'd firstly like to say nutrition supports the pharmacological methods for pain management, meaning it cannot work alone. We can't leave the opioids and sleep on nutrition. Also, herbal supplements are defined as products coming from plants and claiming medical properties that can treat or prevent disease. Dietary supplements are defined as non-containing minerals, herbs, vitamins, which are intended to add nutritional value. I'd like to give you a few tips on nutrition and chronic pain. First, the aim has to be sorry for that.
Sorry for that, colleagues. Technical problems here.
Sorry, let me start over with the tips for nutrition and chronic pain. Firstly, I was saying the aim has to be to reduce inflammation to help protect your body. That means you have to include foods that contain antioxidants and omega-3 in your diet. You should also try by all means to prevent vitamin and mineral deficiency. You should also stay hydrated because dehydration can increase sensitivity to pain and wound healing. So here's a list of important nutrients which are normally used for managing pain. There is vitamin B12, which can be found from egg, milk, salmon, or beef liver. It is used to ease neurological pain. Vitamin C, which is found from citrus fruits, bell peppers, and strawberries, is usually used to reduce muscle and skeletal pain. It is also used to ease constipation, which can be caused by opioids like morphine. Vitamin D, which is absorbed from sunlight, standing in the sunlight for 10 to 15 minutes, exposing your legs and arms, helps you get sufficient vitamin D for a day. It is also found in eggs and fish. It is used to ease back and muscle, as well as skeletal pain. We also have magnesium, which is found in green leafy vegetables like spinach, nuts, and then there's legumes. It is used to reduce neuropathic muscle pain, headaches, and it also aids with sleep and manage stress. The antioxidants are vitamin A, E, and zinc, which can be found in carrots, avocados, beetroot, sweet potatoes, etc. The antioxidants support immune systems and reduce pain, which can be caused by inflammation. Here is a list of herbal medications or supplements that are found to be helpful. I'd like to put out a disclaimer that some of these plants, they are just traditional plants found in Eswatini and other African regions. There isn't enough scientific evidence to support their effectiveness. However, we've had patients in our home visits who've also mentioned that they've been using them to help ease pain. So for example, we have Ukovu, which is a plant that grows naturally in the country. We have Unyamati, we also have Infuma, Omnei, then there's white willow bug extract, which is sold in pharmacies. We also have turmeric powder, we have ginger, we have omega-3, which is a supplement, we have chamomile. I'm sure most people know it as chamomile tea. We also have glucosamine, and then we have bromelain. These herbals or supplements are not limited to these. There's also others out there, but for today, I'd like to discuss a few. So we'll start off with turmeric. I'll give you the function and a way to prepare them, and then some side effects or other comments based on that product. So turmeric is used to ease neuropathic pain and control inflammation. You can prepare it by mixing a 1/4 teaspoon with 2 tablespoons of lemon juice, diluted with 1 cup warm water, and drink. In capsules or tablets, which are found at pharmacies, you have to take 400 and 600 milligrams 3 times per day. There's, however, concerns on increased risks of stomach ulcers, which are caused by turmeric. So people with gallstones are not supposed to take turmeric. We also have ginger, which is used to relieve arthritis, pain, and knee pain. It can be eaten raw in a few bites, or you can add it into boiling water and drink. Usually, it is recommended that you take at least a cup per day, a cup being 250 grams. It mustn't be mixed with blood thinners or aspirin, because it has contents which act as aspirin. It can also lead to heartburn. We also have Infuma, which is traditionally grown in the country. It is used to release back pains. It also eases pains in swollen regions. We only use the Infuma fruit to suppress pain by using a compressor. So you have to boil the fruit of the Infuma plants in water and use that to massage the painful area. You are not, under any circumstances, advised to drink it because it is deadly. We also have Umnei, which is also a plant that grows in the country. Traditional healers still use it to this day to help with pain. We use the stem bark to relieve back pain. You have to prepare it by having a glass of water, boil the bark in the glass of water and drink. You can also eat a few bites of the bark. And then we have chamomile, which is used for skin conditions and mouth ulcers, which can be caused by some of the opioids during treatments. We also have chamomile tea, which is used for anxiety and sleeplessness. How to prepare it is to use 2 drops of the oil on a hot compressor and apply on the achy area. You can also drink it as tea. It is sold as oils and tea in shops and pharmacies. We also have bromelain, which is pineapple stems. These are used to ease inflammation and infections. You can boil the stems of pineapple and drink half a cup of water with the pineapple stems. It can also be used as an application to the skin. If you're buying the capsules from a pharmacy, you're advised to take 200 and 800 milligrams between meals. It can cause stomach upset and diarrhea. I'd also like to involve Dietary, which aids in abdominal pain. You are advised to take 1 teaspoon per day in hot boiling water. It also helps reduce blood pressure and reduces cancer risk. We have cayenne pepper, which has capsaicin, which aids in the healing of muscle and joint pain. It is advised to take half a cup of water plus 2 tablespoons of the cayenne pepper powder and use it as a paste in the swollen area or the achy area in your body. You can also sprinkle it in food during cooking. And then lastly, we have the supplements omega-3, which are sold over the counter in pharmacies. They are used for joint pains and rheumatoid arthritis. They can also be found in fatty fish. Their effects on the body may take 6 weeks for a patient to actually notice the significant change. That is if the patient is not using any other options. Here is something that is worth noting when using nutrition or herbal medications as supplements for pain management. Other herbal medications are not advisable to use due to their adverse side effects. For example, we have aloe vera, which is sold in most stores in the country. It causes nausea, vomiting, and diarrhea. We also have garlic, which increases bleeding risk if used in an unmonitored way. And then honey and cinnamon's benefits are usually outweighed by their high amount of sugar content. In summary, I'd like to say what you eat has an impact on how you feel, be it pain or your mood. Nutrition cannot be used alone to manage pain. Just like I mentioned earlier, that we still need to use the opioids. It's just a supplement, or it works alongside the opioids. And then putting the right foods into the body can help to improve your levels of pain, mood, sleep, and digestion. Food can really be medicine, and your diet should be an important part of the treatment plan, which is why it is advised that you focus on changing your lifestyle or diet as soon as you're diagnosed or even prior to that. Thank you so much. I'd like to give the table.
Okay, thank you so much. Let me thank God for an informative presentation. I will give this opportunity to the floor to those who would like to add something. It may be a question, it may be a comment at this juncture. Okay, I see a hand from Sister Trustee.
Thank you so much for such a fruitful presentation.
Sister, are you there? Sister, we cannot hear you.